I know that one of the questions that I get and the governor gets all the time are from people who are wondering, when will things get back to normal, and what will that be based on? This is a question that we wrestle with constantly. It's a complicated answer. There's no doubt about it. And I first want to start with the good news. The good news is that thanks to the wisdom and decisive action of the Governor DeWine, Ohio's in a much better place today than we thought it would be. We have not experienced the catastrophic scenarios that we surely would have if those actions hadn't taken place. So that's the good news. And it's not only the governor's actions, more importantly, it's your actions in response to what he asked you to do, which was the social distancing, the hygiene habits, and all that comes along with trying to make sure that we slow the spread. And that's the good news, because collectively, we as a state have saved a lot of lives and avoided the catastrophic scenarios that we surely would have experienced without those actions taking place. Now, the bad news is that we are still deep in the midst of a health crisis. In a few moments, Dr. Acton's going to give you the statistics of what happened overnight. More people went to the hospital, more people died than the day before. And those aren't models, those are real people. Those are people with families, people with loved ones, and we deeply, deeply care about what happens to them, and that we know that we are still in a battle that has to be won. And that's the bad news. But another consideration also as you look at this is something the governor touched on earlier, which is the existence of PPE. We don't have enough yet. We have to conserve what we have, because there are many people out there on the front lines who need it and deserve it. And we can't open things up and put more people in jeopardy until we have the protective equipment that will give them a sense of comfort and a sense of protection that they really deserve as they're out there working and trying to serve all of us. And we're working hard at it. We're trying to build the capacity in Ohio from our manufacturers. We're trying to acquire it wherever we can. You know, they're really the big pieces, and it's really trying to find that balance, the balance to execute the Ohio strategy. And I know that as we continue to do this, that we're going to be better off. So in digging into this, you know, we ask ourselves, well, what might that future look like? What could that future look like in Ohio? Governor announced a team of people from the private sector that are working on this. We have a staff of people in the health that are working on the health aspect of this, consulting medical professionals. We're not doing this in isolation. We are asking people who know, who are professionals, who are experts at this, you know, what is it that we need to do to help? And so life won't exactly go back to what it was like pre-coronavirus. There will be a lot of thoughtful decisions that need to be made to make sure that as we emerge from the first surge, that we don't create a second surge of spread. A vaccine would be a game changer. We would love it if there was a vaccine. That would solve so many problems, wouldn't it, Dr. Acton? But it's not likely that we're going to have that for a year or longer. And one of the people who I think we all in this room respect, and I think the nation respects, Dr. Anthony Fauci, said it like this: it's not like a light switch, on and off. It's a gradual pulling back on certain of the restrictions as we try to get society a bit back to normal. And Dr. Fauci continued that the first condition is a steep drop in the number of cases, which we haven't seen yet in the actual number of cases. And you've got to make sure you are absolutely going in the right direction. And then he said, you gradually come back. You don't jump into this with both feet. And that was the advice of Dr. Fauci. So what does this look like? Like, what can you, I imagine if I'm out there and I'm trying to think, how do I prepare for this? What does it look like? And it looks like it's pretty much common sense as we go through these things, but I'm going to give you a few examples that have been deployed around the world and that people who are working on this are going to suggest. First of all, the emphasis on hygiene, even when that day comes that we relieve the restrictions, does not go away. It's not going to go away. Hand washing, sanitizers, these are still going to be part of our lives. Masks will become more common and should be to control the spread. Gloves too. And as I have to smile a little bit, don't be offended if you don't get handshakes or hugs for quite a while. We're going to have to change the way that we interact as long as this is a threat in our lives. Testing, we need more of it. Testing is critical to finding our way out of this. More tests determine who's carrying the virus, and then the antibody testing that we've been working on is very important because we'll know once we have that who has the defense. And who is going to be better able to do some of the frontline work that we need to have happen. And there's also a lot of talk, this is something that many states are working on, a lot of talk about effective supplemental tools to track the symptoms data and to know who you may have come in contact with who had the disease or where people are who have the immunity. Crowds in crowded areas will be bad for a while. This is not something that we're going to flip a switch on for sure. This is what all the studies have shown, how difficult that is. So if you think about this as an employer, that's your workspace configuration and common area configurations. However you're looking at it, we're not going to allow, or not going to want people to congregate, even when we begin to restart some of these things. That might mean more space between tables, staggered seating, limiting congestion in crowded spaces, appointment-only access, checking temperatures if you can, particularly if you have a lot of people who are interacting in a space. You don't want to have the spread. A dedicated cleaning staff and common spaces and entryways. These are just some of the elements that businesses and people around the world who've experienced this have employed to slow the spread or to stop it from reemerging as a threat as they begin to resume normal life. And if it can be done safely with hygiene and social distancing, then those are the things that come back first. If it can't, those are the things that will follow later on. And vulnerable populations, they're going to have to continue to take care of themselves and take these precautions. These are all the things that are emerging on these lists of how we reemerge. And these are the kinds of things that the governor will have to take into consideration along with the health data as we begin to think about what restart looks like. And I guess I want to close with something that I read yesterday from one of President Trump's economic advisors, Larry Kudlow. And what he said is that it's the health people that are going to drive the medical-related decisions. But I still believe, hopefully, and maybe prayerfully, that in the next 4 to 8 weeks, we will be able to reopen the economy and that the power of the virus will be substantially reduced and we will be able to flatten the curve. And so I guess as we enter Passover and Easter, the Easter Holy Week, amen to that. Let's hope that we are able to restart this as soon as possible, but you now have hopefully a better understanding of the factors that go in and why Ohio is well positioned, but why Ohio still has work to do. So thank you, Governor.